We are the Gujarat Technological University. Since its inception over a decade ago, GTU has been empowering young and curating minds to realize their true potential. Over 4 lakh inspired students are enrolled with one of the premier academic universities in India. With more than 450 affiliated colleges in its fold operating across 5 zones of the state, GTU, the International Innovative University, your place to move forward.
Namaste dear student. Today we discuss about the sulfonamides. First one, we discuss about the basic description of sulfonamide. First, sulfonamides is the first antibiotics. Those used pyrogenic bacterial infections. Pyrogenic, that means those are varieties of condition that inducing our body temperature. This enzyme we can this pyrogenic bacterial infections. In Germany, 1935, by scientist Dogma, he discovered the sulfonamides on the mice. Done experiment streptococcal infections. It highly effective but produce bacteriostatic actions. Chemistry behind the sulfonamide. All sulfonamides are derivatives of sulfanilamide. This is the most important things. GPAT like examination, those are may become asked. Sulfonamide, it's the derivatives of sulfanilamide. It's nothing but para-aminobenzene sulfonamide. Para-aminobenzene sulfonamide. The general structure of sulfonamides, here you can see this is the sulfanilamides or para-aminobenzene sulfonamide, those containing the amine group NH2 and sulfonilamide as SO2 NH2 group. Next is the classification according to therapeutic uses of sulfonamides. First, topically applied sulfonamide is containing eye infections, sulfacetamide for skin infection, silver sulfadiazine and mefenide acid. This sulfur sulfadiazine today it is also used for the burning purpose. GIT infection, succinyl sulfathiazole, phthalate sulfathiazoles and sulfaguanidine, meningitis, sulfadiazine and sulfadiamidine, urinary tract infection, and sulfioxazoles and sulfamethylpyrazine. Respiratory tract infection also use sulfafenazine and cotrimoxazole. Leprosy, dapsons is the most important drugs and solapsons. Drug used for bowel infection, sulfasalazine and ethyl sulfathiazole. Malaria, sulfadoxine and pyrimethamine, and nocardiosis, sulfadiazine and sulfazoxazole. Next is most important thing is the mechanism of action. These bacteria required folic acid for the growth and development. In this mechanism, the para-aminobenzoic acid are converted into dihydrofolic acid in the presence of the dihydropteroid synthase enzyme. This dihydrofolic acid is converted into tetrahydrofolic acid or nothing but folic acid in the presence of dihydrofolate reductase enzyme. And these tetrahydrofolic acid as well as the folic acid converted into purine as well as the DNA and these DNA are responsible for synthesis of bacteria. So this is the metabolic pathway. In this metabolic pathway, the sulfonamides are binding with the dihydropteroid synthase enzyme by the substrate mechanism. सपोज के सल्फोनेमाइड का कंपटीशन पाबा के साथ होगा. दिस इज द पैरा एमिनो बेंजोइक एसिड, इन दोनों के साथ, और इसमें से सल्फोनेमाइड डाइहाइड्रोप्टेरोइड सिंथेस के साथ जल्दी बाइंडिंग हो जाएगा. ड्यू टू दिस पैरा एमिनो बेंजोइक एसिड कैन नॉट बी कन्वर्टेड इनटू डाइहाइड्रोफोलिक एसिड. This is the mechanism. This cannot be converted. Dihydrofolic acid cannot be converted. Tetrahydrofolic acid cannot be converted. Furin pyrimide cannot be converted. And DNA cannot be used by bacteria. The bacteria, those are that become inhibit the growth. This is the mechanism of sulfonamides. Therapeutic uses: the urinary tract infection that may be used. Acute bacillary dysentery in the intestine infection, those are that become used. Meningococcal infection, that means outer layer of the brain, those are also treated with sulfonamides. Pharyngitis, inflammation of the pharynx as well as the throat, red coloration you can see, this is the inflammation happening in the thorax. Tonsillitis, tonsil inflammation, here you can see this is the tonsil inflammation, those are also recovered by using sulfonamide. And conjunctivitis, that means inflammation of eyes, those are also responsible for the treatment of eyes infection by sulfonamides. Burning is the main treatment by sulfonamide. Means silver sulfasalate, this is a burning patient, this is also burning. Infection of lungs, that may be recovered by sulfonamides. Sometimes combination of sulfonamide are used for various type of serious infections. Sulfamethoxazole plus trimethoprim is called as the cotrimoxazole, is the very well known example from combination of sulfonamide. Another very well known example, this sulfadiazine plus pyrimethamine used in the treatment of malaria. This is the combination, those are also used for treatment of various complex type of the disease or infected material. Next is the side effect and adverse reaction. Allergic response, skin rash, itching and photosensitivity is the most important reaction for sulfonamide or sulfonamide. Hemolytic anemia, aplastic anemia, low WBC and platelet due to the sulfonamide. GI disturbance like the anorexia, nausea, vomiting and diarrhea during higher dose. This is also side effect of sulfonamides. Carnic teras, it is another most important side. This type of example or side effect asking to GPAT like examination. What thing in this? Precipitations in the newborn baby due to the displacement of the bilirubin from the plasma protein binding sites. In this photograph you are known, this is the newborn baby. We are very well known the newborn baby, the excess amount of the bilirubin we have to find out inside the blood. But when we are using the sulfonamide or the baby's mother using sulfonamide, those sulfonamide enter into blood circulation of the baby through its feeding, and these enter the blood. This bilirubin moves from the bloodstream into brain tissue, and that increase the size of the brain tissue. This condition we can say this is the carnic teras. Hematuria, that means the urine containing the blood. This condition we can say this is the hematuria. Crystalluria is another most important side effect of sulfonamide. Lead to renal irritations and obstruction in the urine flow. This is the main side effect of sulfonamides. How we can minimize by this side effect? Drinking more water, making the urine alkaline by giving alkaline mixture, using the combination of sulfonamide preparation whose acetylated product highly soluble. Example is the sulfafurazole. We are using for the prevention of the crystalluria. And the next side effect is the most, this is Steven-Johnson syndrome, SJS, shortly we can say. Severe exudation erythema associated with the widespread of the lesion of the skin and mucus. This is the main side effect of sulfonamide. This patient is suffering with the sulfonamide side effect is Steven-Johnson syndrome. Last we discussed shortly how to remember the sulfonamide. So here basic, if we remember basic characteristic, so just you should remember the sulfa, red color indicate this sulfa. First word of the sulfa, S, solubility is low of sulfonamide. Next U, useful for urinary tract infection, that means urinary tract infection use the sulfonamide. L, large spectrum, that means used against gram positive as well as the gram negative bacteria. F, folic acid synthesis blocker, nothing but DHPS, dihydrofolate synthase enzyme inhibitor. Last one, A, anti-metabolite or analog of PABA. This thing you should remember. You are very well known about what is sulfonamide. Next is simply side effect, just you should remember by using the same word. This is sulfa. S, Steven-Johnson syndrome. S, skin rashes. U, urticaria. U, once again urine precipitation or crystalluria. L, leukopenia. Folic acid deficiency. Last one, aplastic anemia. So this is the short key for, or you should remember, sulfonamide. So in the sulfonamide, some question those are asking into the GPAT like competitive exam. Please be read, show carefully. Thank you very much for watching Pharmajosh YouTube channel. If you like, please share, comment and like